All new here at 6, the weekly average of COVID-19 cases is up 25% in Texas compared to a week ago. That is part of what's fueling a rush to find a safe and effective vaccine. Good evening, everyone. Texas health officials we know have submitted a proposed distribution plan straight to the CDC.
But most Texans will have to wait until next summer for a vaccine. 12 News investigator Lauren Hensley is here with the reason why. Lauren.
Yeah, Dejanique and Jordan, if you're thinking this is a long wait, you're not alone. And this is all subject to change, but the state is required to put together a framework for how they'll distribute a COVID-19 vaccine once it's available. A lot remains up in the air. Let's go ahead and take a look at that proposed timeline. Phase 1 scheduled to roll out November through December of this year. It will include healthcare workers and also frontline workers. Phase 2 will begin January through July 2021. That will include critical groups like the elderly and also those in rural communities who have limited access to vaccinations. Phase 3, that's when most Texans will receive the vaccination. That's July 2021 through October 2021. That's a year from here. But the vaccine teams will still have discretion to focus on the vulnerable population if that's what they need to do. And finally, in Phase 5, October 2021, 1 year from now, vaccine availability open through private providers.
It's not going to be widespread vaccination for everybody who wants it. We're going to have to do that in a targeted way. So focusing on those critical populations like healthcare workers, other frontline critical workers, and those people who have health conditions, who are elderly, who are at a greater risk of complications if they get COVID-19.
Again, all of this is dependent on the success of those vaccination trials, and a handful of those trials, well, they remain on hold. Most vaccine trials will require 2 doses, but there's still big questions if distribution will begin in November. All right, guys, and if you want to provide one of those vaccines, you have to be recognized by the feds as well as the state, and you must adhere to very strict CDC guidelines. So far, the state has not released who will be responsible for doling out those vaccinations. Lauren Hensley, 12 News.
All right, Lauren, a lot still to be worked out there. Let's talk about the hospitalizations in Jefferson County tonight. These are the new numbers. COVID-19 patients in general beds increased by 3 today, up to 41. Also an increase of 3 patients who are in ICU. That number up to 17. The COVID hospitalization rate you see there, that's what the state closely tracks. COVID patients account for 9% of all Jefferson County hospitalizations. That number has stayed relatively steady over the past week.